I'm Colin. I am board certified in family practice and lifestyle medicine, as well as I specialize in culinary medicine and food as medicine. A lot of things that we fight, as primary care physicians is the chronic disease burden, the chronic, obesity epidemic, and a lot of it is related to diet and lifestyle changes. Conditions such as obesity, hypertension, hyperlipidemia, or high cholesterol, stroke, cancer, an overwhelming amount of evidence that shows food and lifestyle changes have high association to these conditions. I would say about 80% of most lifestyle related conditions are preventable with proper food and lifestyle recommendations. But we need to know more about food. Where does it come from? How to navigate a supermarket? How does it affect our bodies? Portion sizes, nutrition labels, a lot of things that doctors don't get to receive as a education. My workshop entails demonstrating different techniques, knowledge, basically applications and principles to be able to use not only in the office sense, but also, for at home and also for the community at wide. You're able to gather not just information about, nutrition, you're able to actually apply what a patient would go through a day to day and actually, be able to sit down with them and say, okay, these are the different foods that, you want to aim towards. These are the different portion sizes. These are the sources that you want to get your food and actually go into the kitchen and learn about how to apply it. You can just literally take that back home and immediately, actually apply that to your patient population and communities.